Ladies and gentlemen, thank you very much for coming. We would like to start the book launch symposium, Japan World Bank Partnership Program on Universal Health Coverage. I am Satoko Ito, Managing Director of JCIE. I will be serving as the Master of Ceremony. I'm pleased to welcome all of you. Without further ado, we will commence the opening session. Speakers will come up on the stage. Please welcome them with a big round of applause. From this point onward in the program, Mr. Akio Okawara, Chairman of JCIE, will be the moderator.
こんにちは。ただいまご紹介ありました。
Good afternoon, ladies and gentlemen. My name is Okara from JCIE. I will be serving as a moderator of the opening session. I look forward to working with you. And here on stage, we will be explaining throughout the afternoon. The event is sponsored by the Japanese government and World Bank. And we have the presence of Minister Minorikawa, who has taken out of his busy schedule to be with us. And from World Bank, we have Ms. Akiko Maeda, and someone who has given birth to this program, Mr. Keizo Takemi, member of the House of Councillors at the JCIE. The position of our organization is a cooperating organization. This is an enormous and grand program which continued for 3 years, and it's a great honor that we've been able to take part in it. And at the same time, I'm very happy that we are seeing this day materialized at the JCIE. For ever since 45 years, we have been implementing policy dialogue related to Japanese external relations ever since year 2000. One of the important themes is global health, which has emerged. And starting 2007, we've launched the Global Health Program, of which Mr. Takemi is chairman. And based on the ideal of human security, we have been promoting Japan's contribution. And under the program, we have Professor Ikegami, professor of Keio University, and professor of Tokyo University, Professor Shibuya. They have cooperated to publish the Lancet Japanese feature on 50 years after universal health insurance in Japan. And this triggered this joint research. We hope that this joint research and results would promote effective cooperation for global health and would help to build international partnership in an age where people are discussing the international contribution and the way it ought to be. Without further ado, we'd like to invite Minister Minorikawa to give his opening remarks.
ご紹介いただきました財務副大臣の皆
Thank you very much for the kind introduction. I'd like to thank you very much for your attendance today at the book launch symposium on universal health coverage for inclusive and sustainable development. I'd like to celebrate the publication of this publication along with those in attendance, and I'm very happy that the symposium is being convened. In opening this symposium, we have someone who has exerted strong leadership and promoted joint research, member of the House of Representatives, Mr. Keizo Takemi, and co-author, Ms. Akiko Maeda, lead health specialist, health, nutrition, and population global practice, World Bank Group, and Professor Michael Reich, professor of international health policy at Harvard, and Professor Naoki Ikegami, professor at the Keio University, Keio School of Medicine. I'd like to express my due respects to them, and I'd like to express my gratitude to the two entities that have cooperated, that is JCIE and World Bank. Recently, health needs in Japan in the world is diversifying, and it is becoming increasingly complex. If we look at a breakdown by disease of the causes of death, we see that there's an increase in heart disease and cerebral apoplexy and diabetes. These chronic diseases outweigh the deaths by infectious diseases and such acute diseases. With regard to chronic diseases, early detection and treatment. And in addition to that, daily health management is very important. Recently, the threat of Ebola hemorrhagic fever has in the background a meager public health system and shortage of appropriate medical staff. And these are thought to be one of the causes. The World Health needs are diversifying, and in order to cope with this, we need to strengthen the health system of the society as a whole. And in order to do this, we need to try to aim to realize the universal health system where everyone can have medical services when they need it, and which is of high quality and which is affordable. The joint study is such that it's been 50 years since we've achieved universal health coverage in 2011. And with this as a trigger, we have been implementing since 2012, January, a joint research between the Japanese government and the World Bank research so that it can be leveraged for health policies of the developing countries. And we hope with a view to having our knowledge and findings being leveraged for universal health coverage realization. In December of this year, Deputy Prime Minister Aso and Finance Minister and Minister of Health, Labor and Welfare, Mr. Tamura, and President World Bank participated in the Ministerial Conference for Health Policies, and we had government and international institution representatives, researchers, and we had over 200 members present, and there was a very active discussion. And in the recent Washington IMF World Bank annual meeting, we had Mr. Asa present, as well as Mr. Keith Hansen, World Bank Vice President, and we had an event to commemorate the publication of the research, and there were over 100 people, and we had promoted the research results of this work. And universal health coverage is such that it's not a one-off endeavor. It has to be maintained across generations. And as the report says, we need to set prices for medical prices and pharmaceuticals, which are the targets of all insurance. And we need to regularly revise this under the medical reimbursement system. And we need to control medical cost. And we need to maintain a fairness between insured persons who are participating in the insurance program. And appropriate distribution of medical resources and medical resources is what is needed. And that is exactly what we have been doing on a continuous basis. We hope that this interesting and beneficial research results would be shared by those in Japan, and we hope that that Japan's knowledge, which we can contribute to the international world, will be further deepened. And toward the realization of universal health coverage, we would like to continue to support. We hope that this discussion will spark further efforts toward this end. Thank you very much for your kind attention.
Thank you very much, Senior Minister of Finance, Mr. Minorikawa. We will continue on. I will call upon Mr. Keizo Takemi, Co-Chair, Coordination Committee, Japan World Bank Partnership Program on UHC. Since 2007, he's been serving as the Senior Fellow of JCIE, our organization. Mr. Takemi, floor is yours. Thank you very much for your kind introduction. I am Keizo Takemi, member of the House of Councillors. In fact, as Chairman Okawara explained to you, since at the time of the G8 summit of 2008, Japan was hosting that conference, and I organized the Sherpa organization on the theme of healthcare, and we have made the recommendation of strengthening the healthcare system, particularly finance, information. And one more point, that is the human resources in the field of healthcare. These three building blocks were introduced in our recommendation. We renewed our recommendation at the next G8 summit in Italy. We have made that recommendation. So I was leading the activities of this Sherpa group comprised of public and private sectors. Now then, in 2011, that was the 50th anniversary of the universal insurance system in Japan. And amongst the countries, we have not only the longevity, but the healthy longevity in Japan. So there was a focus of attention from the international community how Japan was possible to do it. So there was a huge in-depth attempt, that is the Lancet production of the commemorative issue. And also I was the chief editor of the publication by Lancet to elucidate the secret of longevity. Since that time, I've been involved with this field. 3 years ago, once again, 11 countries were selected as case studies to study universal health coverage from an economic aspect as well as other healthcare-related policies. We should not discuss the policies in isolation from other matters. We must include the related areas. We must have an integrated research, and that was the start of this joint research program. At that time, once again, because of the process of the history, I was the co-chair of the coordination committee of Japan World Bank Partnership Program. Having said so, I would like to say that we now go into the post-MDG discussion, post-2015. Secretary General Ban Ki-moon is working on that, and 17 items include health and human well-being. So more than ever, health is being closed up. It's not good enough just be healthy. Because you are healthy, you must be able to have a better and more significant life. The international community is now in the process of discussing that. So I think this joint research program is the pioneer and spearheading these efforts in international community. These days, we are haunted by the big serious communicable disease of Ebola hemorrhagic disease, fever in West Africa. The 3 victimized countries are suffering from a very poor healthcare system. In some countries, healthcare system totally collapsed. Probably that was one of the reasons why the Ebola sort of occurred in these countries. This was now being shared in the international community. So from the viewpoint of controlling the communicable disease, primary healthcare is regarded important. Healthcare system must be reinforced based upon the primary healthcare. This once again showed that this is the new international challenge. Lastly, I would like to point out that as Vice Senior Minister Minorikawa said, it's not good enough just to achieve the universal health care. Everybody must be able to afford the universal health care, and they must be able to access the preventable disease control regime. Once you achieve that, you will hear the greater voice of wanting quality medical care, which will increase the costs. The countries are developing, then it's all right. But in the process of maturing, the countries will lose the fiscal basis to enable that. And there is a loss of sustainability in healthcare. So in that sense, we start immediately prior to the high economic growth era, we have achieved the universal insurance system. Regarding the economic policies, the income, national income was increased, and also the universal pension system was achieved. Including the tax system, we have a package of providing the middle income people in the society who are healthy and having a middle level of income. During the level of high economic growth, the income gap did not grow, and income gap was narrowed. In that process, we achieved where we are now. But now we are living in the population decrease era. We are losing sustainability in healthcare. We have to rebuild healthy society with longevity in a new set, a new definition. So, as ahead of others in the world, we are the developed country when it comes to aging. So, universal health coverage is taken up as a major theme related with the health policy. So, when we consider a general package of the universal health coverage, we can position Japan as a country which already has an experience to a certain extent. So, inclusive of our own experience to the international community, to the countries which will go through the similar experiences going forward,
の関連する
the related policy areas would be coordinated with the healthcare policy.
そしてそれぞれの国の実
We will consider the policy in an integrated way so that we can build a system in a sustainable way. Japan can make a great contribution. I am convinced about that possibility. So based upon our own experiences, we have the outcome of the research, joint research. Joint research is a kind of Japan's contribution of our experience. So this is the joint research with the World Bank. I'm sure that going forward, this research will be continued in some form or another, so that through the coordination with the World Bank, we will be able to find a new contribution to the international community. From a viewpoint of policy development, I hope that we can make a further contribution. So this is what I wanted to tell you about the report, as well as my gratitude to those people who were involved in this endeavor. Thank you very much.
竹見先生、ありがとうございます。
Thank you very much, Mr. Takemi. We've had from Minister Minorikawa and Mr. Takemi outstanding speeches. I think that made the base for our symposium today. So, although this has been rather brief, we'd like to conclude the opening session at this point. Thank you very much, everyone. We'd like to ask the speakers to come up on stage, please.